Welcome again to another video, and in this bite-wing radiograph we will see different filling and restorative materials. Starting from upper 7, we will see the composite filling over here, a class 1 filling, and then on this upper 6 we will see another occlusal filling, but in this case it is an amalgam filling. Compare the radio opacity between the amalgam and composite, and underneath the amalgam you will see an area of a lesser radio opacity, which is the lining material, zinc phosphate cement mostly. We can't say that this is a filling over here. The radiograph is not very clear, or the image of the tooth is not very clear. If we go down, we will see that there is a porcelain. This is porcelain fused to metal. This is the metal crown, and the tooth is root canal treated. You see the gutta-percha here, and as a retainer, a threaded screw has been fabricated, retentive screw. You can see the threads of the screw over here, extending down into the 2/3 of the root filling. Another two screws actually we can see over here in the mesial and in the distal canals. They are longer, of course, however they are thinner in diameter than the one which is used in the lower 5. These are used to retain the porcelain fused to metal crown, which is used to restore this lower 6, which is root canal filled, as you can see here, the gutta-percha. Another amalgam filling, class 1 filling, and the lining material seen underneath. An interesting case where apparently there seems to be a mobile teeth and an attempt to immobilize these teeth and fix them in place was used by a stainless steel wire. As you can see, the stainless steel wire over here. Usually the stainless steel is affixed to the crowns of the teeth using composite, and I want you to have a look at the contact points. See this radio opacity over here. This is the shadow of the composite, which is used. Actually all this area is composite. This is the level of the composite which is used to retain this stainless steel wire. So you can see the contact here is not clear because of the presence of the composite. Again, here it's not clear. There is overlapping here, but we can see the shadow of the composite material that is used to retain this wire. Okay, now the teeth themselves, some of them are root canal treated, 1, 2, 3, and you see these radio opaque amalgam filling. It means that these three teeth are episectomized with a retrograde filling, and an amalgam has been placed, and we can know this from the radio opacity of the material. Now, the root canal filling here, you can see that composite has been used to block or close the access cavity in this area. This tooth is still apparently under treatment, and you can see that this is composite, and this radio opacity over here is the calcium hydroxide that is placed in the canal as an intracanal medication, and then there is composite used here to close the access opening of this root canal treated tooth, and there is a trace of a remaining calcium hydroxide that is left. This tooth, the access opening apparently has been blocked by amalgam has been used to block or to close the access cavity, and an attempt or you can see traces of calcium hydroxide again left in this area. So what we can see here is a stainless steel wire that has been fixed by a composite, and we can see gutta-percha, amalgam, and traces of non-setting calcium hydroxide. This tooth, or these two teeth, were crowned using porcelain fused to metal crowns. They are joined together, so they are in one piece. We cannot see any. See the metal. The metal has, the two teeth has been stored in a single restoration, and this is the porcelain. Porcelain always has a lesser radio opacity than the metal. Depends how thick the porcelain that has been used to cover the metal core. And again, there is a prefabricated post that has been used. You can see it from the threads to skewer or to stabilize this crown, and the remaining of the root canal filling of the lower 5. The lower 4 is not root canal treated. The root canal is patent. No gutta-percha is used to treat it. Root canal treatment for the lower 6. See how big the amalgam is. This DO filling, this is the distal part or the distal box, and this is the occlusal part. It apparently all the pulp chamber has been filled with amalgam, and the amalgam extends, could be to the on the buccal and the lingual aspects of the tooth. We cannot tell actually, because the pulp chamber, we cannot tell if it is either this is the superimposition of the amalgam on either side, the buccal or the lingual, or it is actually filling the root. The pulp chamber is completely filled by the by amalgam. The mesiobuccal and the mesiolingual roots were treated with gutta-percha, and if you concentrate here, you will find a piece of a broken instrument. It could be a broken file, a broken reamer, or that has been left there because no attempt was done to take it out. On the distal root, have a look at the root gutta-percha. This appearance, the wavy appearance of gutta-percha, usually you see it with the thermofilled root canal, especially if it was done in a hasty way, in a fast way. Usually it takes this shape. So this wavy appearance is characteristic of the thermofilled or thermo-injected gutta-percha. It will assume this shape. 3-unit bridge, porcelain fused to metal on a root canal filled tooth. Another one, this is the distal on the 6th, and this is the pontic over here. You can see that they are joined all in a single unit on a root canal filled tooth, and if you concentrate here, it could either be an amalgam, remaining amalgam, or a foreign material that has been left in this area. Composite, root canal filling, and porcelain fused to metal on a root canal filled tooth. So composite, this is calculus over here, okay? Or this could either be calculus. This is definitely calculus, and this could be a broken or a chipped piece of the filling that has been lodged in this area. So we have composite, porcelain fused to metal, another composite, and of course this is the gutta-percha filling. What you see here is the apical seepage of the root canal sealer beyond the apex of the root canal fill tooth. This area is actually the clamp retainer which is used to hold the rubber dam. So root canal filling, gutta-perca, and the sealer that has passed through the apical foramen. Another case of a root canal, composite, used to close the access cavity, and then this is the root canal filling, and you can see here that is the sealer again has been pushed out from the apical foramen in this upper central incisor.